Question 1. What is the primary purpose of a prescriber writing dispense as written, DA, on a prescription? A. To allow the pharmacy to substitute a generic drug. B. To require the pharmacy to dispense the brand name drug. C. To indicate the prescription is a refill. D. To authorize the pharmacist to change the dosage form. Answer: B. To require the pharmacy to dispense the brand name drug. The concept here relates to brand versus generic drug dispensing rules often impacted by insurance or prescriber preference. When a prescriber writes dispense as written, DA, they are specifically instructing the pharmacy staff to dispense the brand name version of the medication, not a generic equivalent, even if one is available. This overrides any potential generic substitution allowed by state law or insurance plans. It's important to pay close attention to this instruction when filling a prescription to ensure the patient receives exactly what the prescriber intended. Remember, DA means the prescriber wants the brand drug. Question 2. A prescription calls for amoxicillin 500 mg capsules number 30. The average wholesale price, AWP, is $15.00, the pharmacy's cost is AWP 10%, and the dispensing fee is $5.00. What is the final price to the patient? A. $13.50. B. $18.50. C. $20.00. D. $10.00. Answer: B. $18.50. This question tests your ability to perform basic pharmacy pricing calculations. The pharmacy's cost is AWP $15.00 minus 10%, which is $15.00 $15.00 asterisk 0.10 equals $15.00 $1.50 equals $13.50. To find the final price, you add the dispensing fee $5.00 to the pharmacy's cost $13.50 plus $5.00 equals $18.50. Understanding how pharmacies calculate the cost of medication plus a fee is fundamental to processing prescriptions accurately. Always calculate the drug cost first, then add the dispensing fee. Question 3. According to federal law, which controlled substance schedule has the highest potential for abuse and no accepted medical use? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer: A. Schedule 1. This question assesses your knowledge of the Controlled Substances Act and its scheduling system. Federal law categorizes controlled substances into 5 schedules based on their potential for abuse and medical use. Schedule 1 drugs, like heroin or LSD, are defined as having a high potential for abuse and no currently accepted medical treatment use in the United States. Understanding these schedules is crucial for handling controlled medications legally and safely in a pharmacy setting. Remember that Schedule 1 substances are the most restricted and are not available by prescription. Question 4. What is the generic name for the brand name drug Zoloft? A. Fluoxetine. B. Sertraline. C. Citalopram. D. Paroxetine. Answer: B. Sertraline. This question requires you to know the generic equivalent for a common brand name medication, specifically an antidepressant. Zoloft is a widely prescribed medication, and its generic name is sertraline. Knowing the generic names of common brand name drugs is essential for processing prescriptions, managing inventory, and communicating effectively with patients and healthcare providers. Many insurance plans prefer or require dispensing generic versions when available, so recognizing this pairing is important. A good strategy is to learn common brand/generic pairings for the top 200 drugs. Question 5. A patient asks for an over-the-counter, OTC, recommendation for heartburn. Which class of medication is commonly used to reduce stomach acid? A. Antibiotics. B. Antihistamines. C. Proton pump inhibitors, PPIs. D. NSAIDs. Answer: C. Proton pump inhibitors, PPIs. This question tests your basic knowledge of common over-the-counter medication categories and their uses. Heartburn is caused by excess stomach acid irritating the esophagus, and proton pump inhibitors, PPIs, work by significantly reducing the production of this acid. While other options treat different conditions, antibiotics for infections, antihistamines for allergies, NSAIDs for pain/inflammation, PPIs are a primary class for managing frequent heartburn symptoms. Knowing the general use of different OTC drug classes helps you direct patients appropriately or answer basic questions. Remember that PPIs are focused on reducing acid production. Question 6. A medication label reads, "Store at controlled room temperature." What is the typical temperature range for controlled room temperature in Celsius? A. $2:\circ\text. C. $to$8:circ\text. C. B. $15:circ\text. C. $to$30:circ\text. C. C. $0:circ\text. C. D. $20:circ\text. C. Answer: B. $15:circ\text. C. $to$30:circ\text. C. This question assesses your understanding of proper drug storage requirements, which is a critical aspect of quality assurance in a pharmacy. Controlled room temperature, a standard storage condition for many medications, is defined by regulatory bodies as $15:circ\text. C. $to$30:circ\text. C. $59:circ\text. F. $to$86:circ\text. F. Storing medications at the correct temperature range is vital to maintain their stability, potency, and safety. Always check medication labels for specific storage instructions to prevent degradation. Question 7. What is the primary purpose of a drug formulary? A. To list all available drugs worldwide. B. A list of prescription drugs covered by a health insurance plan. C. A document outlining drug manufacturing processes. D. A guide to drug interactions. Answer: B. A list of prescription drugs covered by a health insurance plan. This question relates to the financial and administrative aspects of pharmacy practice, specifically dealing with insurance. A drug formulary is a list of prescription medications selected for coverage by a health insurance plan or healthcare system, often tiered based on cost to the patient. Formularies influence which medications a patient can afford or access easily under their insurance benefits. Understanding formularies is important for processing insurance claims and helping patients understand their medication coverage. It's essentially the list of drugs your insurance will help pay for. Question 8. A patient is prescribed metformin. What common condition is metformin used to treat? A. High blood pressure. B. High cholesterol. C. Diabetes mellitus type 2. D. Asthma. Answer: C. Diabetes mellitus type 2. This question tests your knowledge of the indications for common medications, specifically a widely used anti-diabetic drug. Metformin is a cornerstone medication for managing type 2 diabetes mellitus, helping to control blood sugar levels. Recognizing the primary use of frequently prescribed drugs like metformin is essential for verifying prescriptions and assisting pharmacists. Many patients with type 2 diabetes take metformin daily. Question 9. Calculate the dose of a medication for a child weighing 44 pounds if the dose is 10 mg per kilogram per day. A. 200 mg per day. B. 440 mg per day. C. 4,400 mg per day. D. 20 mg per day. Answer: A. 200 mg per day. This question requires you to perform a dosage calculation based on patient weight. First, convert the patient's weight from pounds to kilograms. 44 pounds / 2.2 pounds per kilogram equals 20 kilograms. Then, calculate the total daily dose using the given dosage rate, 10 milligrams per kilogram per day * 20 kilograms equals 200 milligrams per day. Accurate dosage calculations, especially for pediatric patients, are critical for patient safety. Always ensure you convert weight to kilograms when the dose is provided in mg/kg. Question 10. Which of the following is not a required piece of information on a prescription label according to most state laws? A. Patient's address. B. Pharmacy name and address. C. Prescriber's signature. D. Prescription number. Answer: C. Prescriber's signature. This question tests your understanding of the essential information that must appear on a dispensed prescription label. While the prescriber's signature is required on the original prescription itself to make it valid, it is typically not required to be printed on the label affixed to the patient's medication container. Prescription labels must include patient details, name, sometimes address, pharmacy information, prescription number, drug name, strength, quantity, directions for use, fill date, and cautionary statements. Focus on what the patient sees on the bottle. The prescriber's signature isn't usually there. Question 11. What does the abbreviation QSAD mean on a prescription? A. Take by mouth. B. Quantity sufficient up to. C. Every other day. D. At bedtime. Answer: B. Quantity sufficient up to. This question assesses your knowledge of common pharmacy abbreviations used in prescriptions. The Latin abbreviation QSAD stands for quantity sufficient up to or at a sufficient quantity to make. It is often used in compounding to indicate that a base or diluent should be added until the total volume or weight of the preparation reaches a specified amount. Understanding abbreviations is vital for accurately interpreting and compounding medications. If you see QSAD, think fill up to this amount. Question 12. Which governmental agency is responsible for enforcing the Controlled Substances Act? A. Food and Drug Administration, FDA. B. Drug Enforcement Administration, DEA. C. Centers for Disease Control and Prevention, CDC. D. Federal Trade Commission, FTC. Answer: B. Drug Enforcement Administration, DEA. This question tests your knowledge of the federal agencies involved in regulating pharmacy practice. The Drug Enforcement Administration, DEA, is the primary federal agency responsible for enforcing the Controlled Substances Act of 1970, overseeing the manufacture, distribution, and dispensing of controlled substances. While the FDA approves drugs for use, the DEA focuses specifically on preventing the diversion and abuse of controlled medications. Remember, the DEA is all about controlled substances. Question 13. What is the most important step to prevent medication errors when receiving a new prescription? A. Estimate the filling time. B. Verify patient identity and date of birth. C. Look up the drug's price immediately. D. Prepare the prescription label. Answer: B. Verify patient identity and date of birth. This question highlights a critical aspect of quality assurance and patient safety in the pharmacy. The most crucial first step in processing a prescription is confirming that you have the correct patient by verifying at least two identifiers, such as name and date of birth. This prevents dispensing the wrong medication to the wrong person, which is a significant source of errors. Always double-check patient information before proceeding with filling. Question 14. The brand name drug Synthroid is commonly prescribed for which condition? A. High cholesterol. B. Hypothyroidism. C. Depression. D. Bacterial infection. Answer: B. Hypothyroidism. This question tests your knowledge of common brand name drugs and their primary uses. Synthroid is a widely recognized brand name for levothyroxine sodium, a medication used to treat hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone. Recognizing this common drug condition pairing is important for understanding prescription orders and patient profiles. If you see Synthroid or levothyroxine, think thyroid hormone replacement. Question 15. Calculate the flow rate in ml/hour for a 1000 milliliters 4 bag to be infused over 8 hours. A. 80 milliliters per hour. B. 100 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. Answer: C. 125 milliliters per hour. This question requires a basic calculation related to 4 infusions. To find the flow rate in ml/hour, you divide the total volume to be infused by the total time in hours. In this case, 1000 milliliters/8 hours equals 125 milliliters per hour. Accurate 4 calculations are essential in hospital or compounding pharmacy settings to ensure patients receive the correct amount of medication over the prescribed time. Flow rate is simply volume divided by time. Question 16. What is the generic name for the brand name drug Lipitor? A. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer: B. Atorvastatin. This question asks for the generic name of another very common brand name medication, specifically a statin used for cholesterol. Lipitor is one of the most prescribed drugs globally, and its generic equivalent is atorvastatin. Knowing the generic names of popular brand name drugs is essential for pharmacy operations, from inventory management to patient counseling. Many patients will now receive the less expensive atorvastatin instead of brand name Lipitor. Question 17. What does the term PRN mean on a prescription? A. Take by mouth. B. As needed. C. At bedtime. D. Before meals. Answer: B. As needed. This question tests your understanding of common prescription abbreviations. The abbreviation PRN comes from the Latin pro re nata and translates to as needed. This indicates that the medication should be taken only when the patient experiences a specific symptom or situation, rather than on a fixed schedule. Recognizing PRN helps ensure the patient takes the medication appropriately according to their needs. PRN gives the patient flexibility to take the dose when required. Question 18. According to HIPAA, what is the primary purpose of protecting protected health information, PHI? A. To prevent drug diversion. B. To ensure patient privacy and confidentiality. C. To track medication errors. D. To standardize drug pricing. Answer B. To ensure patient privacy and confidentiality. This question relates to pharmacy law and patient privacy regulations, specifically HIPAA, Health Insurance Portability and Accountability Act. HIPAA's main goal is to protect the privacy and security of individuals' protected health information, PHI, which includes any information about a patient's health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. Maintaining patient confidentiality is a fundamental legal and ethical responsibility for all pharmacy staff. HIPAA is all about keeping patient health information private. Question 19. Which type of error occurs when a patient receives a medication to which they are allergic? A. Prescribing error. B. Dispensing error. C. Administration error. D. Adverse drug event. Answer D. Adverse drug event. This question tests your understanding of medication error classifications and patient outcomes. An adverse drug event, ADE, is any injury resulting from medical intervention related to a drug, which can include allergic reactions, side effects, or medication errors. While it might stem from a prescribing or dispensing error, the event of the patient experiencing harm due to the drug, like an allergic reaction, is classified as an adverse drug event. Preventing ADEs is a primary focus of quality assurance. Think of an ADE as the harm that happens to the patient because of the drug. Question 20. A prescription reads lisinopril 10 mg per daily. What route of administration does PA indicate? A. Applied topically. B. By injection. C. By mouth. D. Rectally. Answer C. By mouth. This question assesses your knowledge of common medical and pharmacy abbreviations for routes of administration. The abbreviation PA comes from the Latin per os and means by mouth or orally. It indicates that the medication should be swallowed. Understanding route abbreviations is crucial for dispensing medications with the correct instructions. PA is one of the most common abbreviations you'll see. Question 21. What is the maximum number of refills allowed on a prescription for a Schedule III controlled substance? A. 0. B. 1. C. 5. D. 11. Answer C. 5. This question tests your knowledge of federal regulations regarding controlled substance refills. According to federal law, prescriptions for Schedule III and IV controlled substances are permitted up to 5 refills within 6 months of the issue date. Schedule II substances, however, cannot be refilled. Knowing the refill limits for different controlled substance schedules is essential for legal and compliant pharmacy operations. Remember the 5 and 6 rule for CIII and CIV. Question 22. A pharmacy technician is checking the expiration dates of medications on the shelves. This is an example of what quality assurance activity? A. Inventory management. B. Medication therapy management, MTM. C. Stock rotation and inspection. D. Compounding. Answer C. Stock rotation and inspection. This question relates to standard quality assurance procedures in a pharmacy setting. Checking expiration dates and ensuring that newer stock is placed behind older stock, stock rotation, is a fundamental practice to prevent dispensing expired or subpotent medications. This activity falls under the umbrella of regular stock inspection and maintenance designed to ensure the quality and integrity of the drug inventory. This is a hands-on way to keep the pharmacy safe. Question 23. Calculate the day supply for a prescription of atenolol 50 mg, Sig, 1 tablet per daily, quantity, number 90 tablets. A. 30 days. B. 60 days. C. 90 days. D. 180 days. Answer, C, 90 days. This question requires a simple calculation to determine how many days a given quantity of medication will last based on the directions. The patient takes 1 tablet per day, and the total quantity dispensed is 90 tablets. To find the day supply, divide the total quantity by the number of tablets taken per day. 90 tablets / 1 tablet / day equals 90 days. Calculating the correct day supply is important for insurance billing and helping patients understand when they will need a refill. Day supply is total quantity divided by daily dose. Question 24. Which of the following drugs is classified as a beta blocker and is commonly used to treat high blood pressure? A. Omeprazole. B. Amoxicillin. C. Metoprolol. D. Atorvastatin. Answer, C. Metoprolol. This question tests your knowledge of common drug classes and their therapeutic uses. Metoprolol is a widely prescribed medication that belongs to the beta blocker class, primarily used to treat conditions like high blood pressure, angina, and heart failure. Omeprazole is a PPI, amoxicillin is an antibiotic, and atorvastatin is a statin. Recognizing common drug classes helps you understand how medications work and what conditions they treat. Look for drug names ending in olol as a clue for beta blockers. Question 25. What is the purpose of a laminar flow hood in a sterile compounding area? A. To store medications at controlled temperatures. B. To provide a clean air environment for preparing sterile products. C. To count tablets quickly and accurately. D. To dispose of hazardous waste. Answer, B. To provide a clean air environment for preparing sterile products. This question relates to practices and equipment used in sterile compounding. A laminar flow hood, also known as a sterile hood or clean bench, is a piece of equipment that creates a unidirectional flow of filtered air, HIPAA filtered, to minimize the risk of contamination during the preparation of sterile medications like IVs. Maintaining a sterile environment is critical to prevent microbial contamination in injectable or ophthalmic preparations. The flow hood is your barrier against airborne germs when compounding sterile products.